Welcome friends, welcome to Dab Jones Yoga's online short videos on joint pathologies and compensations that we find in our bodies. Today we're going to be looking at opening up the hip flexors, an area of the body often spending a lot of its time in a short position, spending too many hours of the day seated at a desk. This can often lead on to lower back issues, can lead on to hip impingements. The practice I'm going to be showing you today is going to help alleviate these symptoms just from a few simple stretches. I'm going to give you a little bit more information on what exactly is the biomechanics and the anatomy of what you should be looking at trying to achieve, and why in which some people can start to experience lower back pain due to the function and the movement that's created through hip flexion and hip extension. So if I come up into this position here, now, the muscles here at the front of the hip that are responsible for bringing the thigh up like this is known as hip flexion. So what you're actually doing here is you're shortening the hip flexors to bring the leg, the hip, into this position. Now, typically, if you think of a seated posture, sitting at a desk or seated like this, these muscles are going to be in what's called a short position. These hip flexors are going to be in a short position. Now, if we're spending 8 to 9 hours of the day in this seated position, our hip flexors are going to become chronically in a short position. What happens if you actually get stuck in this position and they find it very difficult to either shorten effectively and they find it very difficult to lengthen effectively. So what we're going to find ways in doing here is to enable the tissues there to be able to do both functions effectively, being good in a short position and also being good in a long position. Another point to consider here, so if these muscles are in a short position, let's say you come out of your seated posture from your desk and you've been in a flexed hip for however long, then you're going to come up into a standing position, and what you'll actually find is some people's posture will actually change. So their pelvis will turn forward and down, and you can see as I make this posture here, I already have an extra sort of a deeper curve in my lower back. And this is just due to the fact of these chronically short hip flexors. Okay, so these simple stretches then is going to help recorrect, open up the hip flexors and bring length to our lower back, which will hopefully help reduce any compression and any uncomfortable sensations you sometimes experience in the lower back area of the body. You will need a blanket for this brief few rounds of poses. So what I'd like you to do is to place the blanket on your mat, step your left foot forward and the right knee on the mat. So what you can see here is I have my rear knee just roughly below the hip. A very simple stretch, kneeling lunge stretch. Engage your rear glute. As soon as you engage your right bum, you can touch it if you're unsure what that feels like. It should feel relatively engaged, contracted. As soon as you access the contraction here in the buttock, in the glute, you'll then start to experience this stretch in the front of the hip. And you can feel the stretch through the front of your right hip here. Give yourself up to 30 seconds in this stretch. You can apply a nice calm breath in this stretch by breathing in through your nose and out through your mouth. And 30 seconds can be anywhere between kind of 5 to 7 full breaths. So give yourself that time just to allow the tissues to open up. I'm going to complete my next breath here and I'll show you what's next. Okay, release, step the front foot back onto the knee, back onto the blanket. Now, once we stretch out this rear hip, then what starts to happen is you actually get to gain back the relationship between the hip flexors and the glutes at the back. They work as a partnership, flexors and glutes. Whilst one is shortening, the other one is lengthening, and vice versa. So essentially, once we start to open up these chronically short tissues in the hip flexors, we should start to then radiate, or at least be able to effectively engage the glutes. Now, the real beauty of engaging the glutes, when they contract, they actually as well pull the back of the pelvis in a downward rotation, known as posterior tilt. So this, of course, is going to be really effective when we engage the glutes. Place the blanket to one side, lie on your back, now bend in the knees, feet on the floor. Take your right foot just a little bit wider than the hip, and then cross your left leg over your right. What you're going to do here now is press your lower back into the floor, and then pressing down through the right foot, lift the hip. What you're going to do here, you're going to feel an engagement through your right glute. So this is the same hip that we stretched in the hip flexors before in the kneeling lunge. So make sure it's the same side. And then from here, we just do a few rounds, repetitions. We lower the hip down, and then we slowly lift it up. A guideline, you should be able to, I would say, do roughly about 10 without it being too demanding. Work up to 10. Taking your time with it, not kind of thrusting the hip up too strongly, just finding that kind of smooth movement between lowering and rising the hip. Once you've done this movement, this repetition, this dynamic movement 10 times, complete your final rep and then hold the hip in extension like this and see how long you can hold it for before the muscle, the glute here, the gluteus maximus, starts to fatigue a little bit. And the longer you hold this here, you really start to feel the glute do its job of firing, of turning on. And once you've had enough, just simply release, lower the spine back to the floor. You can uncross the legs. Turn your body to one side, come up to a seated position. Okay, so I just did the right hip there. You would, of course, then repeat that same sequence on the left side. Do the kneeling lunge, left knee back, do the stretch of the hip flexors, and then repeat the hip raises on that left side. As you start to get more competent at this, you could increase the amount of reps that you do for the hip raises and increase the length of time you do while stretching the hip. I hope you found today's short video useful. Enjoy. Namaste.